Transplant rejection, transplant rejection, memorization under 5 minutes. So, how to identify type of rejection? If you see that the patient who underwent a transplant rejection and within minutes, just within minutes, patient is starting to experience thrombosis and some ischemia and fibrinoid necrosis, and patient is unstable, then that is hyperacute rejection. And in that case, the graft must be removed. If the patient has been experiencing unstable vitals and they say that there are some features of thrombosis of the graft vessel, immediately remove the graft. And this is a type of hyperacute rejection. Next is if the patient presents with onset of vasculitis or graft vessels with dense interstitial lymphocytic infiltrate within weeks to months, let's say 5 weeks, 6 weeks after the transplant rejection, most likely this patient is undergoing which kind of transplant rejection? Acute, acute transplant rejection. So what's going on here is that patient is experiencing cellular and humoral insult. Cellular is when they have CD8 plus T cells and or both or one CD4 plus T cells activated against the donor MHC, which is a type 4 hypersensitivity reaction. Remember, type 4 hypersensitivity reaction is past 72 hours or more. So that is type 4 hypersensitivity reaction. And in acute transplant rejection, you see type 4 hypersensitivity reaction. In humoral insult, you see similar to hyperacute, but the antibodies that developed after transplant are associated with C4D deposition. Next is patient presents to you after months, like 6 months to 1 year, and he says that he has been having some heart issues and on incidental finding, you see vanishing bile duct syndrome, or you have chest X-ray done which shows bronchiolitis obliterans or chronic allograft nephropathy. Then that is chronic transplant rejection. And what's happening here is both cellular and humoral components are being attacked. So type 2 and type 4 hypersensory reaction is going on, and you are basically seeing dominated arteriosclerosis, where recipient T cells react and secrete cytokines